welcome back to Conversations with Therapists. This is Alyssa. I'm Jennifer for Teamy Brand Marketing, and with us today we have Dr. Shara Goudreau, and she is an EMD certified therapist based in Florida, but with a fully virtual private practice. So Shara is an expert at helping women overcome and heal from their inner critic. She is EMDR and ego state therapy. So you help women deal with past trauma, anxiety, burnout, and we're going to get really into the nitty gritty of all that good stuff today. She also is licensed in Florida to supervise. What'd you say? The paid
Yes, registered interns. So after graduating from their graduate programs, those who are seeking hours towards licensure.
Awesome. Great. So when we talk about your private practice, infinite potential awaits, we'll ask you some questions about that too. So welcome, Shara.
Hi, I'm so happy to be here. Thank you for having me.
We are so excited. Okay, so I want to jump right in because you are our first, well, you're not our first clinician that's licensed to do EMDR. You're just the first one we really talked to because you put such a focus on your professional life on it. So I want to talk about that a little bit with you. And then also, I want you to specifically talk about the differences between like EMDR and then like EMDRIA certified, because I know there's a big difference. So wherever you feel like your journey started with EMDR, that's where I want you to start.
Okay, great. Sure, I'd be happy to talk about that. So, yes, I'm an EMDR certified therapist. I've completed the basic training for EMDR through EMDRIA. So, I know you asked about EMDRIA. It's the EMDR International Association that oversees and certifies the training and the fidelity to the EMDR therapy. So, I'm trained through EMDRIA, and I also have completed hours towards my certification. So I'm certified, which means in addition to the training, I sought additional consultation, an additional 20 hours for that, and then some additional courses to have the certification attached to my name. In addition to that, I'm also right now completing my hours for consultant status. So I'm working towards being a consultant. I'm a consultant in training, and that is where I provide consultation services to other clinicians to help them on their journey towards certification or to have a better grasp or understanding of EMDR, how to use it with clients. And, it's kind of similar to the process of supervision, what we ask our registered interns to do. They work with a supervisor, but this is more consultation based. So the work that I'm doing is seen by other consultants, and I consult with them on my consultation. So I'm almost completed with those hours, and then I'll be hopefully approved by EMDRIA to be a full consultant.
Cool. So what does it look like when you're like, if you have somebody coming to you and they want consultation, because your therapy practice is totally virtual. So are you like in a room with them, or are you just like, if they're on a Zoom, you're on the Zoom with them and their client? Like, I don't even know what it means to supervise for EMDR or how they do that.
Yeah, so my practice is fully virtual. So the clients that I see through Zoom and virtually. It's a HIPAA compliant version of Zoom. And similarly, when I do supervision with interns or when I'm doing consultation with other clinicians who are using EMDR, I'm also using that Zoom platform to meet with them. Some of my consultees will bring in recorded sessions, so they get permission from their clients to record sessions. We have them sign, consent form, and they record those sessions and then they bring them back into consultation where we review them, or we'll talk about them. We talk about cases. We might talk about areas of stuck points, like I'm using EMDR and it's been great and suddenly it's not working. We'll try to troubleshoot, understand why it might not be working. I'll help them work on things like, case conceptualization, understanding our clients through the understanding of the theory, how the theory would help us to understand and explain why our clients are suffering, what's perpetuating their suffering, how we can help them with their suffering. Right. So those types of things are the things that we cover in consultation. Specifically with EMDR, we're looking at the fidelity of using the standard protocol, helping with competencies that clinicians need to be able to effectively use EMDR with their clients.
I think that's so cool. Okay, first, but for those out there who haven't heard of EMDR, what is EMDR and why is it not necessarily popular, yes, but like, why is it so effective? Why is it becoming popular? Because it's effective.
Yeah, so EMDR stands for eye movement desensitization and reprocessing. It was started in the late.
It's so much easier to say than
I know, mouthfuls.
impressive. Like we could just
I
got
know.
it there.
I know. So yes, it's a long name, so we shorten it EMDR. It was started in the late 1980s by Francine Shapiro when she was walking through the park and she realized that these eye movements appeared to decrease some distressful thoughts and feelings that she was having. It was best known and initially named for eye movements, but the eye movements really is only one form of bilateral stimulation that we use to help clients with reprocessing experiences or inaccurate information. So what is EMDR? I kind of gave you a very brief background of it. Well, it's a therapy that helps process traumatic memories and inaccurately stored information to help reduce a person's emotional distress by using either eye movements or another form of bilateral stimulation.
I just think that's really cool because it's like you don't really realize how much your eyes are connected. I mean, I know it's only part of it, but how much your eyes are connected, and then that concept of kind of moving back and forth,
I do that with the music too. What is that called?
it's bilateral stimulation.
Yeah, yeah.
Oh,
There
yeah.
it is.
Right. And so binaural beats, if you've ever heard of binaural beats, is the same idea. It will alternate, the sound will alternate between one side or the other, kind of goes back and forth. That's a form of bilateral stimulation that we can also use in EMDR. So, it started with these eye movements, but we're not married to eye movements. It's really about what fits the client best. Some clients only prefer audio. They don't like the eye movements, or there's a reason why they can't do the eye movements. Some clients hate audio. Some clients like a combination of audio and visual, where, in session, you might have seen, a therapist kind of moving their finger, follow my finger kind of thing. There's lots of ways we can have clients follow some kind of stimulus, and then they'll follow it. Virtually, we can do this with software where there's a ball and somebody will follow the ball back and forth across their screen. Again, we can do it through audio. We can do it through tapping, just simple tapping, alternating tapping. Prince Harry made kind of the butterfly tapping a little bit more, I think, known among people. He was on a segment on Good Morning America a couple years ago, a few years back. And he demonstrates his use and how EMDR has been helpful for him. But there's lots of different ways that we can do the bilateral stimulation, not just eye movements anymore.
Okay, this is a weird question, but my brain, because I have ADHD, got very focused on the audio because I like to listen to bilateral audio when I'm in a stressful situation, but it's usually because I'm not having to talk or be in a conversation with somebody. So in a session, how do you play audio for them and then also still go through, I guess, the prompts that you have to go through or the wording you have to say? How do you do both?
Yeah, it's a great question. So when we have the client use the bilateral stimulation, whether it's audio or whether it's visual cue, there's a series of questions and things that we set up beforehand, right? And there's an assessment. We call this the assessment phase. So EMDR is an 8-phase treatment model, and it's only really during phase 4 where we're talking about using this bilateral stimulation to help reprocess memories. There's other times we can bring in bilateral stimulation. This is during an earlier phase where we're preparing clients to be ready to get to some of the more adverse or difficult, challenging situations to reprocess those. But in the preparation phase, we can actually use bilateral stimulation as well. When we are doing that, we are giving some kind of a prompt, and then we're having them kind of focus on, there's this in the reprocessing phase of phase 4, there's a dual attention to what's happening now with that stimulus. And then there's the stuff from the past. We don't want clients to be too far in the past or too present. We kind of want one foot in the past and one foot in the present. That's dual attention. So we're able to kind of have them be connected with both at the same time. But while they're watching that, I'm not talking, right? So I'm not asking them to talk. They're watching this, I'll prompt them to maybe focus on something. We'll do some sets. And then after the set, I might ask, what did you notice? And then they report back what they noticed.
Interesting. So I'd love to talk more about the women you're actually working with. Your website really sticks out in my head because you had the themes of gold and light and beams, and it was so beautiful. Infinite potential awaits.com. But on your website, you spoke so directly to women and how your methods help them. They're struggling with holding it all together, and you're helping them release and find freedom from that. Was there a personal moment or professional moment when you were like, this is what I want to do. These are the women I want to work with, and EMDR
Yeah.
is how I'm going to help them.
Yeah, absolutely. So I would say it was really around when the COVID-19 pandemic started. So I was meeting with clients, and of course there was like this big collective trauma that was happening with the pandemic. And I was hearing about the current challenges and traumas that my clients were experiencing. And I started noticing that the clients who were previously getting by the best that they could, they were like spinning the plates, they were juggling all these balls in the air, lots of roles, lots of responsibilities that they had. The pandemic really pulled the rug and the foundation out from under them. And suddenly all these spinning plates and these balls in the air came crashing down. And so it was really like at this moment for many of my clients where they made the choice, wow, okay, I really have to tackle this really big thing right now. I'm more willing to explore, examine my own history, my own previous experiences that got me to this place today, and understand like why I feel I can't rely on anyone, that I have to take it all on. I have to hold it all together for everyone all of the time, or I have to do this on my own. Or why do I keep seeing the same patterns show up in my relationships? And so I saw how much strength and resilience that these clients had who were willing to do this really, because this is really tough, difficult work to look inward, right? And do this work of self-exploration. And I was just in awe and admiration. And I think that was like that moment. I'm like, okay, I know this is where I want to be, what I want to be doing.
Yeah.
Wow.
I think that's so cool. Were you doing EMDR before that, or was this first and then kind of the next step was EMDR?
No. So it was around the pandemic, around that time where I was like, ooh, okay, there's so much trauma happening, so much happening around us. I really need some other tools. The theories that I was using in my practice prior to that were helping, but I felt we're not getting to the root of some of the concerns and issues that were coming up with my clients. So that's when I decided to go and seek additional training, specifically in trauma work, and EMDR just really spoke to me. And when I took the training and I learned more about it and I read the books, and I was like, oh my God, this is amazing. Like I fell in love with it, and I saw how effective it was and how effective it is with my clients.
I think that something that's important to my understanding is EMDR works for trauma, yes, but it's not necessarily always like these movie level trauma events in your life. It can be like the trauma of like moving out of your parents' house, right? Is it that base level, and maybe that shift into like adulthood and stuff was so hard, and it's a big pivot. Like what's the level of trauma that's like
Violent trauma,
oh,
or
yeah.
Yeah.
assault, things like that. I
Yeah.
guess the question I'm trying to find is like, are you seeing patterns? Like, what are your clients dealing more with? Anxiety, inner critic, childhood trauma,
Yeah.
just trying to find a way?
What's the level of
Yeah.
trauma?
Yeah, you bring up really great examples of all the types of trauma that come in to my practice. So for some people, it's really like we call them the unicorn, who comes in and they only have like one single kind of episode or one single traumatic experience that they want to work on.
What are those people like?
I know. I know. They're very difficult to find, and God bless them. So, I think that's amazing. But usually what we see is there's a lot of like complex trauma. So my practice, I tend to focus a lot more on like attachment, developmental trauma, childhood trauma, as you said. And so, yes, EMDR is effective in working with trauma, whether it's complex trauma that's from childhood on, or it's single incident trauma. It could be those big T's like you were talking about, assault, violent type traumas, car accidents, major things like that. But there's also what's called small T's, and small T's are just as impactful for people. That's like being picked last in gym class, for example. You're the only kid kind of sitting in there. What's happening, whether it's a big T or a little t, the way that the like EMDR and the theory, the AIP, adaptive information processing model theory works, is we look at how how we show up in the present is really formed by these experiences in the past. So when you mentioned somebody might come into my practice like, I'm so anxious all the time, I just don't understand, or I feel like I can never let go of work at the end of the day, like I'm constantly on the go, or I'm always like overworking myself, right? Whatever the symptoms are, they are symptoms of something else that have happened. And somewhere along the line, through the big T or little t experience, there was an accurate information that kind of went into the program of our mind, right? So if we go all the way back, and I give you an example from childhood trauma, an example might be like a kind of more of a benign situation. It doesn't mean that there was significant neglect or there was significant abuse, but it could just be that child, right, who's sitting on the living room floor putting together some Legos, and a caregiver, a parent, let's just say mom in this example, mom is busy, she's working from home, she's got lots of responsibilities with work, she's got a lot of responsibilities at home, she's trying to manage it all, she's really stressed out, there's a big deadline, whatever it is, right? There's lots of stress right now. She's trying to get dinner ready, and the child is like, mommy, look at my Lego tower. Like, look how amazing this is. Look at it, right? And so mom is totally overstressed, totally overwhelmed, right? Lots of noise happening in the background, totally overstimulated. And mom snaps like, oh my God, I don't care about your Legos. Like, oh my God, right? Like, pots are boiling over on the stove and I've got all this pepper. Like, who cares about your
I've
Legos?
done
Right?
Did that yesterday.
Okay, normal response, right? Like, we get overwhelmed as parents, and overstimulated sometimes. But what happens for that child? Well, the way, young children's brains are organized and develop, like developmentally appropriate kids are very egocentric, right? And so they tend to take on the responsibility of other people's responses or other things that have happened, right? So the idea here, what that child learns is not mom is overstimulated, mom is busy, mom's got a lot on her plate. It's, oh, I'm bad, I shouldn't bother mom, I'm a nuisance. And that inaccurate information gets plugged into the system, right, into our brains. And so then as we kind of are building the blocks of our life, that thought, that core belief is really deeply seated, in our minds. And we tend to see the world, understand our experiences from that belief. And so when something else later on comes up, so it's present day, and we ask our partners, our spouses, our partners, whoever, hey, can you look at this draft? Putting my resume together to apply for this new job, and spouse or partner, whoever, is busy, and they're like, I will, but I can't get to it later. What happens is we don't say, oh, my partner is busy. We tend to go back to that belief of I'm a bother, I'm a nuisance, right? And so what we do, right, we're not looking at trauma here per se, but we're looking at how inaccurate information was stored. And what EMDR will do is help us go back to that Lego incident. We can actually get back there, even like really young, like kids and memories, really, really little. Get back there, help to reprocess it so that more helpful adaptive information can go in, so that we can show up in the present and be able to say, partners just really, they've got some deadlines, they got some stuff to work on. We'll get to it later. We'll be able to work. It doesn't feel like this massive rejection.
That's so interesting. There's probably not a real timeline, but how long do you feel like it usually takes for somebody to either get back to that, maybe that first instance, or start to realize like there have been, I'm sure the whole thing is kind of like peeling an onion. Like you're just like peeling it back and peeling it back and peeling it back until you get to like the center. And that's the thing. That's the memory.
Yeah. So I think it depends on the client's history, right? So somebody who has a very complex history of trauma, where there was neglect or there was abuse in childhood, it will be a lot more challenging and difficult to get there. Not to say it can't, we can, but there's a lot more preparation work and safety in the therapeutic relationship that has to happen before we can go back and get there. The system, like, our brains are just so freaking amazing, right? How we can set up these kind of survival mechanisms to keep us safe and thriving, right? And those served us, they were a purpose that served its purpose for a very long time, kept us safe, but not as useful sometimes or helpful in adulthood, and they still tend to show up. And so we have to work with the system to feel safe, and for the client to feel comfortable and safe, to be able, for the system to be able to go back and even allow those memories to come up into consciousness, because a lot of those are kind of stored separately, or they're not aware. Those memories may not be aware to the client. And we can get there. We can even get to pre-verbal memories. So stuff that happened when we were, believe it or not, even like in utero. We can get back.
Weird. That's
Yeah.
so weird.
I'd love to talk more about how you built the virtual practice. We've talked about your kind of certifications and stuff. How did you decide that virtual was the way to go, and how have you grown your client base through a virtual practice? I know a lot of the therapists we talk to now have a lot of trouble with their virtual practice online because they can't register in Google Maps with a specific location, and they're oversaturated by all kinds of competitors with Google AI and Google search. So what challenges have you had, and how are you facing them, I guess?
Yeah.
Yeah. So when I opened up my private practice, it was during the pandemic. So there was no choice but to be virtual. And then what I found was as things started to ease up, clients really liked the accessibility, the ease of just, getting online and doing their sessions. So most of my client base prefers to be virtual. I haven't shifted. I do have an office that I rent space and I go in once a week for that, but I really haven't had many people reach out. And I wonder if there's the connection to the population that I serve, which tends to be more, trauma, attachment trauma. I think there's a sense of like comfortability being in your own home to be able to do, right, some of these sessions in the deep work. You can get your favorite blanket. You can go to a place that feels really comfortable in your home. So I think that is one of the reasons why my clients prefer to stay virtual. Yeah. And so I think when you said the Google My Business, oh my gosh, that brings up, I do my own EMDR work on that because that experience of trying to get on Google has been really challenging. They don't make it easy for practices. They don't make it easy for virtual practices. So I think the thing that helped me with that challenge was to have a physical space that I rent out to be able to use the address because otherwise I was kind of hitting roadblock after roadblock, and I work a lot of times out of my home. I didn't want to list my home address, right? I didn't want clients to be able to kind of drive up to my house. So
Hey, can I come see you?
right, like I had this thought and I really want to process it with you, right? So yeah, it's that has been a challenge. I think having a strong presence online, having a beautiful website, thank you both, has been helpful. And the other piece of it is the networking. Like the stuff that I do, like I have not brought in clients from like directly from my social media posts, but I think what it has done is help me become aware in the minds of other therapists who can refer clients when they don't have a spot, or maybe it's an issue or concern that they are not working with. They're like, oh yeah, she works with dissociative disorders, and they'll think of me and refer clients that way. So I do think that having a social media presence still is important. There's lots of Facebook groups where there's conversations. They're asking like, oh, do you know anyone who specializes working with this person or that person? So I think that's an important space to be in, and having some materials, whether, the Facebook post or Instagram post or whatever kind of post could be helpful. But some of the other digital assets that you guys have created for me have been really helpful. Like the digital, what is it? Like the business card, those types of things have been really helpful to share with other clinicians.
Are you seeing that the newer therapists are having any challenges, whether with their own practice or with the EMDR when they're treating complex trauma?
I do. So yeah, I think that one I think that with any theoretical approach, it's always challenging for clinicians to first master the idea of case conceptualization, right? And so if we're starting at the basic level of case conceptualization, we're using the theory to help us understand our client's subjective worlds, right? Um, it's an explanation that helps us to understand, like, why is our client suffering, or what could be causing the distress? What is perpetuating that distress? And how can we help them? What tools or interventions are going to be helpful to relieve their suffering? And so if we go back to the AIP model with EMDR, this is the theory that informs EMDR. It's the basic tenet of this theory explains like how we show up, as I mentioned before, how we show up in the present is shaped and informed by the experiences of our past. And our brains have an innate ability to process and integrate experiences, but sometimes those things get stuck. And that leads us to feeling distressed. And EMDR can help us to unstick those memories, allowing more adaptive information to flow in, right? It's not, again, the example I gave, like, it's not that I'm a nuisance. It was that mom was really overstimulated that day, right? There's something inherently wrong with me. People are allowed to have reactions, or their reactions are their reactions. It's not about me. And so with a single incident, when there's a single incident, it's more straightforward to use EMDR and the standard protocol that we use with EMDR, and we can help clients fairly quickly resolve the distress. But it becomes a little bit more challenging with complex trauma because there isn't a single episode. There's rather many incidents over time or throughout an individual's life, even into adulthood, that contribute to more complex patterns and survival mechanisms that would require a more phased approach to address the many layers and the developmental gaps or disruptions that may have happened. And so with trauma work, we always say that slow is fast. And with complex trauma, we have to go really slow, and we have to continuously work on safety and stabilization with our clients. EMDR is highly effective for complex trauma, but the preparation and the stabilization does look differently. So I think it's kind of a twofold thing. Conceptualization is hard to begin with, but conceptualizing complex trauma has its additional challenges. And so I think this is really where consultation can be very helpful. And I will consult on cases too. I get stuck at points and I'll work with other consultants and I'm like, okay, what am I not seeing, or how else can I be looking at this? And that can be very helpful.
What were you doing prior to opening your private practice? I don't know that I've ever asked you that question.
Yeah, so it's really interesting and very full circle. So I was working as a therapist, and then I had my kids. I took a little bit of time off. And then I decided, I think it was back in 2016, I'm like, I'm going to go get my PhD because I really want to teach. And teaching in academia, I was really interested in going back to teaching in higher ed. And so I finished my doctorate in counselor education and supervision so that I can teach in clinical mental health programs. And I finished in 2019 and I started teaching in 2020. And then the pandemic hit. And it was then where I really felt a calling to come back to the therapy work. And so I kind of focused on, I opened my private practice. I focused on a lot of this trauma work. I became a trauma specialist, working, what I'm doing and working with clients with complex trauma and dissociation. And so I built up my practice, enjoyed the clinical work, and more recently, I'm like, you know what? I've always really loved teaching, and I've concurrently been adjunct teaching. So I've stayed connected to different universities. Like, I really love this. I really love teaching. And so I'm now back teaching more classes. And in the fall, I just accepted a position as a full-time faculty member in the fall. So I'm going to be back to teaching and doing private practice. So doing both in the fall. So very full circle
Cool.
here.
Can you tell us where you're teaching? You might have. You
Yeah.
might have broken up a little bit, but
Yeah. So I'll be teaching at Lynn University, which is based in Boca Raton, Florida, in their clinical mental health program. It's a graduate program for students who are interested in becoming counselors. And my focus and what I bring, I think, to the program is that trauma-informed perspective. I have a lot of trauma experience as well as trainings, not just in EMDR, but other theories like ego states therapy. I use a lot of parts work. So yeah, I bring in a lot of the trauma, that trauma perspective. And I'm going to be helping with their clinical program with the students who are going on for like their clinical experiences as practicum and internship students. I'll be helping to oversee, the experience they're having at their site. So very excited for that.
is that in person or virtual as well?
Yeah, so they have both. So they have they have online synchronous courses as well as asynchronous courses, and then they have in person. So I'll be doing both.
That's so cool. Yeah, I know my sister graduated several years ago with her master's and did the whole thing online. And I'm just like, that's so cool that I think the pandemic really helped kind of bring online schooling more like not to the front because people are already doing it, but kind of realizing like, oh, you can still get a really good
Actual
education,
option. Yeah.
and it's an actual real option, not just for the people who are like having to work, 40 hours and then doing night school or something like that. Like it started, maybe I'm wrong, but it just feels like that was kind of a big digital industry push across all of the workforce or the global workforce, I guess.
Yeah,
which was so interesting.
it is. And I think that what we've really seen, right, there's kind of been this hesitation, as you said, like occupationally, in school, specifically in my field, clinically, right? Like, is online just as effective? And what we're learning, like, it is, right? So the work can be done remotely and we can be just as effective. I'd argue, if not more effective, in a lot of cases, working from home where we don't have commutes, we don't have, water cooler conversations and things that distract us. We have other distractions like laundry and kids and other things, but we can be just as effective at home. Therapy is just as effective online as it is in person. And it removes some barriers that clients have. And there's more accessibility with virtual and education, right? So I would argue perhaps not younger kids. It might be challenging, and I saw that firsthand with the pandemic. And at the time, I had a first grader, a kindergartner and a first grader trying to take class on Zoom. And it was like, not the best format for younger kids, but older kids, adults can learn just as effectively online.
Yeah, I think that that's really cool. Yeah, I did not realize you had school age kids. I guess I did during the pandemic, but we had like little baby kids, and we're
Thank
like,
goodness.
thank goodness our business is online. But I'm sorry that I have this crying baby on our Zoom call.
Running naked.
Yeah,
behind us.
or
Yeah,
it's just
whatever it is.
cruising around and with diaper.
It's a miracle we got this
Lack
far.
of diaper. Yeah, it's honestly a miracle we survived that with a business.
Okay, well, Shara, thank you so much for being with us. If you are a woman listening to this and you're struggling and finding you need to know where to start, we'll link the website and your information below. And if you are a clinician in Florida who's looking for supervision, we will link that
Or
information
if
as
you're
well.
if you're looking to go back to school.
Or if you're looking to go back to school.
That's so
Yeah.
cool.
Amazing. You are busy.
Yeah.
So
Well,
thank you.
thank you for taking the time out to talk to us. And
Yeah, it was my
we'll talk
pleasure.
to
Thank you so
soon.
much for having me, and thank you for all you guys have done, for my business and my beautiful website. Thank you. I love it.
Yeah, we love it. All right. Well, we will talk to you soon. Bye.